This is Boomer Life on CL 650.
Welcome back to the program. Sterling Fox with you, joined in studio by Dr. Jan Venter from Falls Creek Healthcare Center in Vancouver at 555 West 8th Avenue. Dr. Venter is a family physician, but he's also the founder of Fusion Medical and the Brain Vault Health System, and we're going to talk a little bit more about brain health. But Dr. Venter, one of the things that we didn't talk about a great deal in the segment about executive health was the specific features of the program that Falls Creek Healthcare Center offers to women. So let's talk about women's wellness, specifically the programs available at Falls Creek.
So we are very privileged to offer a women's wellness plan where it's one-on-one 4-hour focused medical history as well as examination.
Still with the 4-hour one-on-one? That's fabulous, you know.
And we also incorporated some time with a nutritionist to help with some women's health issues, and usually helping out with packing kids' school lunches, trying to find out the nutrition value of school lunches, that kind of thing, or if kids are out of university, when they come back for Thanksgiving, what's a healthier way to serve them up some things that will help protect their hearts and their brains. We also have focused ultrasound. We go through checking if there's any plaque buildup in the neck, to any issues around the liver, the spleen, the pancreas, as well as the...
And is this done by CT scan usually?
We like to do ultrasound first.
Okay.
Because it's non-invasive, there's no radiation involved. If we do have something, we have the privilege of doing a CT scan. We have a very fast CT scanner, so and I'm lucky it's just one floor below me, and it's very quick to arrange, and we have the results immediately if we find something troublesome.
Right. So you have that capability. You have that diagnostic backup capability. Okay, let's come in. Let's have a look at what you tell me what you think you have. You describe the symptoms you present, and somehow we're not slackers here. We're pretty crazy on the internet. We do a lot of homework. People show up for a session at Falls Creek Healthcare. They know a lot more certainly than they did even 10 years ago. Hello, doctor. I don't feel well.
Correct.
And that'd be it. Well, now it's, I think I have this, and I check this, and this, and this, and this. And they're quite specific about the problems, or much more so, aren't they?
My colleagues, Dr. Bing and Dr. Google, has been very helpful there.
I'll bet.
So our patients are very, very informed, and I must say very lucky to be a doctor for our Canadians. Very, very proactive, and I'm a big believer in patient-centered health.
Right.
So when our women come in, they've got a pretty good idea of where they want to have their health focused on, and try and dive as deep as they want. And we do very focused breast as well as pelvic exams, including the pap smear.
Right.
My wife recently had to go for a full family doctor in as many years, and it's an intimate relationship you build up with a family doctor, and we try and keep that trusted relationship on with our patients as well. So it's the same face. We have 2 female doctors as well as myself, so it makes it very, very convenient for women specifically to do the women wellness clinic at our Falls Creek Health Center.
Right. Talk to us a little bit about chronic disease and chronic pain management, because that's also a lot of people, get to a point where you have some kind of chronic condition.
Correct.
And they surrender to it. They go, okay, well, I guess this is the way I was intended to finish my earthly days, and so I'm just going to suffer for the next fill-in-the-blank years. I don't think many of us, fewer of us, approach those sorts of conditions that way now than we used to, because we know remedies are available, and multiple remedies in many cases.
Correct. Unfortunately, most of these remedies come in the form of a prescription or a pill for an ill, and we are very good in predicting how drugs will interact between 1 or 2 drugs. By the time you get to the 3rd or 4th drug, all bets are off. There's no computer or supercomputer can predict the interactions. because everybody is different.
Sure, of course.
Some people like to take their pill on an empty stomach. Some people like to take it with a shot of whiskey. Some people like to do it on days that starts with the letter W. So all of us are different, and chronic disease is becoming a big issue. It's currently going beyond what we call communicable diseases. So back at the turn of the century, issues like tuberculosis,
Sure.
Childbirth, sepsis, those were the things that was the hot issue. And we didn't have antibiotics. Now we have antibiotics, however, with some drug resistance, but we can solve most infectious disease, even HIV. I'm proud to say Vancouver's been on a top forefront with Dr. Julia Montagnier. If we can start early enough with HIV, you will stay alive. It's become a chronic disease.
Right. Rather than a fatal condition.
Correct.
Right.
However, diabetes is now becoming a big factor where 1 in 4 kids by the year 2020 are being diagnosed or will be diagnosed with diabetes. And that for me is a scary thought. And it's with that in mind that I became very interested in finding the underlying disease mechanism of why chronic disease happen.
Okay.
And in my search on the internet, I was lucky to discover the Institute of Functional Medicine, who is based out of Seattle, Washington. It's been around since the 1990s. Their first conference was actually, or their first meeting was in Victoria, British Columbia. Proud to say, and its second international conference was in Vancouver, and they love Vancouver.
Okay. What is functional medicine? What does that mean?
So functional medicine is the next evolution of medicine. Is basically how the doctor of the future is going to look like.
Oh.
Armed with the tools of patient-centered medicine. It's personalized, it's predictive, it's participatory, meaning the patient is centric in their disease. I always tell people that, or my patients, that doctor does not mean healer, it means teacher.
Mm-hmm.
And if I can teach you how to live healthier, with my experience, with conferences I attend, with research articles, I have time to do that at Falls Creek. They give me sufficient time to study and research.
Right.
So some of these 4 hours we spend with executive health is time for research with the patient and say, okay, well, I don't know the answer. I think one important thing the doctors need to know is nobody knows everything. There's a statement that half the medical information that we learn in medical school is wrong. We just don't know which half.
Oh. It's not the most reassuring thing you've said.
It is not, and that's why the doctor of the present and future has to stay on the forefront. And functional medicine has been a fantastic tribe for me to join. It's really where the interfaces of systems biology, which means you look at everything. You don't just look at the heart or the brain or the digestive system. You look at everything and
right.
how it interfaces with the genetic, so your family history, your genetics, what we call the omics, so what your microbiome is doing, what your proteins are doing at every single instance. How is your lifestyle affecting it? So things like how do you sleep, how do you eat, how do you exercise, and what is the environment doing? We know we talked about toxins, pollution.
Yes. Right.
I've had to stop advising people to eat tuna. There's just too much mercury in the tuna, and I've had 3 patients in the last month that had high levels of mercury. Now the good news is if your liver and your digestive system is working properly and you can stop eating tuna laden with mercury, your body will clear it in 8 months.
Oh, okay.
And my big focus, like I said, is in brain health, and mercury is unfortunately a big memory thief.
We're going to come back and talk about brain health, but just a quick question about functional medicine. The docs of tomorrow, the way they're going to practice, does that also include the fusion concept of the Eastern and Western combination approach in a functional format?
Correct. So it's a new operating system, and with new operating systems, you have more tools. The box widens. We say it's not just out of the box thinking. You actually open up the box much quicker.
Okay.
So if you know what the underlying cause of disease is, you can then focus on the treatment, and you have much more tools in functional medicine than to regular conventional medicine.
But this is very optimistic stuff. And, of course, it's already being practiced at Falls Creek Healthcare Center every day.
Correct.
Interesting stuff. Our guest from Falls Creek Healthcare Center is Dr. Jan Venter. This is Boomer Life on CIL 650. We're going to talk about brain health when we return after this quick timeout.
Celebrating the baby boomer lifestyle. This is Boomer Life on CIL 650.